Hello, good afternoon. Please, can you hear me? Hello, good afternoon. You can just give me a wave. Okay, great. So we have a lot to do because last week we didn't have a class because it was a national holiday, and so there are quite a lot of things that we have to do. So we are not going to wait for anyone. I'll go straight into what we have to be discussing today. So if you go to the B class, I've uploaded some new documents there for you, and I'm hoping that visit the page for it. And so today, anyway, I didn't even ask how you guys are doing. Forgive me. Please, how are you? I hope you are all well. Please, can you hear me? I'm not at my usual place. I'm trying to figure my way out of the machine, the computer I'm using. Somebody said my voice is low. Is that it? Please, is it low for everybody? I'm doing well, given all that has happened to us over the past week. I'm doing well. So the voice, is it low for everybody, or it's okay? Please, those who are saying it is low for them, kindly open the volume on your device. Open the volume on your device. My volume here is high. Is it better? Okay, so you could also open the volume of your device, and then let's see how it will go. So today we are looking at drug administration and the nursing process. Basically, what we are going to be doing today is what we are going to discuss today, something we've been doing over the years. Can you see my screen? All right, so you can see my screen, and I'll just go straight. We administer drugs all the time, and it's one of these days, it's one of the things that nurses do when they go to work. Basically, there are some of us, when we go to work, we don't do anything except that we administer medications. We don't talk to the patients. Even when we are administering the medications, we don't say anything. We just go and then we are, please, this is your medication, take it. As to what it is for, why they are taking it, how they should go about it, we don't say anything. But this routine task that we engage in every shift can be very dangerous. If you do it well, your patients get better. Even if they are dying, they will die in comfort. If you don't do it well, what usually happens is that our patients end up with all sorts of complications, and they stay longer. There are a lot of errors, medical legal issues that come out of it and all of that. And so to be able to administer your medications and do it well, you need to have an understanding in the basic principles of pharmacology. I just saw a hand up. Okay, maybe she was trying to just, okay, let's continue. You need to understand two main things: the basic principles of pharmacology, which we've looked at, pharmacokinetics, pharmacodynamics, pharmacotherapeutics, and then also the basic principles of drug administration. So you need to understand the various routes, how to calculate the doses, the various techniques that are involved, not just for injection, but also for all the routes. You need to understand the 10 rights. Now some are saying 14, 13, 12 rights, but we are sticking with the 10 rights. When you look at the 14 and the 13 or the 12, it's just the same 10 rights that they're broken it down. So the 10 rights, then you need to know how to educate your patients as well. And so basically under this lecture we look at just that. And so once you understand, you also have to have a fair idea of all the protocols that's used in your facility. Maybe you have a protocol for administering, say, adrenaline, or for administering diazepam, or for administering insulin. Whatever protocols that you have in your facility, you need to be aware of all of them, and then also adhere. Knowing them is not enough, you need to adhere. And then you should be very familiar with the medications that are prescribed in your area of practice. And the reason why I say it this way is that there are so many medications that are out there. Medications you find in, let's say, the medical ward, you won't find all at the surgical ward. Medications, say, that you find at the pediatric ward, or the way it is in the pediatric unit, you'll find it at the adult unit. So you have to be familiar with the medications that you work with. If you find yourself at the accident and emergency unit, or you find yourself at the OPD or the injection room, as some hospitals may have these different units, or whatever unit, the IENT, wherever you find yourself, you should be familiar with all the medications that are there. And then when you are preparing to administer any medications, you need to understand whether the drug is going to produce a local effect or a systemic effect, because that will help you choose the right route. Okay. And once you settled on it, pay attention to the route, the dose, and then the form of the medication. Do you need to reconstitute it? How do you need to how much do you need to add to reconstitute? You need to get all this information, and then you need to also pay attention to details. Sometimes it's the patient's side. From the patient's side, you go, the patient not responding to anything that you say, is just there, not responding in any form, or you go, the patient is telling you something, a nurse gave me something similar. Some of us, we just go without even finding out what it is, we just go ahead and then insult the patient. You are like that. You are always you are always talking about the nurses giving you the medication, meanwhile they have not given it to you, and all sorts of things. We don't pay attention to what the patients are telling us. Additionally, we don't pay close attention to the medications. Sometimes you miss a 0. 550 are not the same. Okay, if you pay attention, you in your head, you know that the drug is administered usually at a dose of 500. But because you are not paying attention, if the doctor has made a mistake and has written 50, you just know it in your head and you go ahead and just do what you know. That may go a long way to hurt your patient, or you may cause an error by just doing that. All right, we don't look at we don't have assessment skills. If we are going to administer an injection, in January, a sister of mine was admitted at the hospital, and where she was, she had an IV access at the back of her hand, and then they had tried at the brachial area. They were not successful, and so there was a lot of puncture and all of that, needle pricks there. And that was the same place. Meanwhile, the other hand is free. That was the same place that another nurse came, another person came. I don't want to give the much details, and applied the blood pressure apparatus, the cuff, just put it there, the same place. My sister was wincing in pain. Just after she finished, they had to administer medications, and the line was blocked. They had to set another one. They didn't assess. It was time for vital, so they just came to do it. She didn't even look at whether the patient had the cannula or not. Just like that, she was doing what she wanted to do. You are going to give an injection. You don't assess the area. If there are scars, there are rashes, you don't assess. You don't even ask the patient whether they have allergies or not. You just go ahead and do it. Please, I keep on saying, in a couple of years to come, and very soon, very, very soon, we are going to have a lot of medical legal issues, because the people who are going to come to take us on are on nursing and midwifery and lab and doctors who have gone to do law and they understand the system. They would come and take us on, and some of us, we will lose our licenses, okay, all because we are not doing the right things. Then we have to be expert at the techniques. Somebody said, Madam, oh, but if you are taking an oral medication, all you have to do is just put water in your mouth and put the medicine in it and swallow. How are you doing it is important to prevent the patient from getting from getting choked, okay, or I mean, for the patient to smoothly take the medications without we use the nursing process. I believe we all know the nursing process. We know that the nursing process has 5. Please, if you can't hear, it is from you. I don't think it is from me. I'm not getting any notice that my network is unstable. Usually when the network is unstable, I will see it and notification will come. Notification comes on the screen that the network is unstable, and that helps me to know. Maybe it is your end. Kindly check your end, please. Kindly check your end as well. It's been breaking. Okay, give me a moment. Let me talk to the IT people and see. Today I'm even in one of our studios on campus, so I'm hello, please can you hear me? So I just said excuse me, I am coming, and then now instead of paying attention, you are here anyway. Please can you hear me? Hello, can you hear me? Is it clear? Okay, because they have checked, the issue is not here. The issue is not here. Those who were saying that the line is breaking, it is not from our end. I'm sure it is from your end. So please check where you are and let us see. All right, let's continue. So the nursing process, we all know all right. So please let's continue. Check your network. All right. So so we know that the nursing process has 5 components. What are those components? Please, if you say it's still breaking, I'm sure it is from your end. Now I'm getting someone. All right, let's go on. I don't know what is happening, but all right. So I was asking about the components of the nursing process. Can we list them quickly? List. I'm not saying that raise your hand. List. Okay. So one of the most important components, not that the others are not important, they are all important. But for drug administration, assessment is very, very important because it's the first step that you go through. Okay, it's the first step that you go through, and it's something that we don't do at all. A lot of us, we don't assess our patients before we give them the medications. We just go ahead and administer the medications. Sometimes we don't even ask the patient's name to find out if it is the right patient. Okay, so assessment is very, very important. And so some of the things that you need to assess, all right, the first thing is ask whether the patient has any food or drug allergies. If there are any food or drug allergies, document on the patient's chart. Okay, very important. Document it. Additionally, you should look out for the medications that the patient is on. So you take a medication history, where you look out for both prescription and non-prescription drugs. And because of where we find ourselves, you need to look out for traditional medicine use. So whether they are into herbal medicines, whether they take it or they prepare it at home by themselves, they prepare their own concoctions, or they rather buy from these what do you call them, herbal medicines that are out there. So you need to ask about all of these, how often they are taking it, what they are taking, how much they are taking, why they are taking it, and if what they've been experiencing any effects. You need to asks all of these. In addition to these things, you need to look out for the injection sites. Okay, look out for the injection sites, the patient's condition, and then for consent, you need to ask for consent. You need to ask for consent. How many of us do this? How many of us ask patients consent? We assume that because the patient is on admission, when it is time for medication, just go and give the medication. So I don't need to ask you whether I have your permission or not. You just go ahead. Whether the patient will take it or not, you just go ahead. A lot of us, we don't do any of this at all. We just go ahead, and then it's time for medication. It's 10 a.m., it's 12, it's 2. So please, no matter what you are doing, you need to take the medications. A lot of us, we don't assess any of the things that I've mentioned. So far as the patient is on admission and the doctor has prescribed it, we are all good. That is it. We are done. It's the end, right? But we need to assess the patient. It's very, very important. Then also there are certain rules of drug administration. These are things that I believe we can all read, but there are a few things that I would want to stress on. 1, don't give any medications that somebody has prepared, and it is something that you do to our students a lot. You prepare the medication and you tell the students to go and give it without any supervision. Please, it doesn't matter whether it's an oral medication or it's an whatever route. Please, students are supposed to be supervised. And I always tell my students, please, when you go and they ask you to go and do anything, ask them to go with you. If they insist that they will not, don't go and give the medications. If they stress you, come and report. Yes, and some of our students are doing well. They report, and the hospitals will come and tell us that, oh, they don't respect. When you tell them to do anything, they don't do it. But how do you expect a second-year student to go and administer an IV medication? How? And there are so many errors that occur just because we allow the students to go and administer medications. So please, if you prepare your medication, administer it. Okay, we'll do dosage calculations very soon, so I will not talk about that. Also, this last point, never crash tablets or open capsules without first checking with the pharmacist or reading the medication information leaflets. Is something we do a lot. We have patients who have NG tube in situ, and they have to be taking oral medications. We just go ahead, get some paper. Some it's so sad. You get you go for your notebook, the back of some book somewhere, or some used patient folder. Now that we are not using the folders again, we have some lying around. We just go and pick it, put the medicine in, get some bottles somewhere and crash. We don't even have the medicine mortar and pestle, and even when we do, we just don't wash it. Every medication the same thing. It is a very bad practice, and please, we need to stop. That it's not every medication you can crash. I will share with you a list of medications that you should never crash or open the capsules. They are done in that way for a reason, and I believe by now you know the reason. So please, do not crash medications. Don't crash nifedipine. Don't crash. A lot of us, that is what we do. We crash nifedipine. I don't know, diclofenac. Meanwhile, the thing has been written boldly. If you look at the box, they will write at the bottom, do not crash. And we are here crashing. all because we don't want to draw the prescriber's attention to the fact that these medications should not be crushed, and that they should put the patient on alternate drugs. Okay, there are medications you can crush them. The ones you cannot crush, please, when you are working as a team, please, you see what, that is where Ghana we are. What is wrong is wrong. If something happens, you will be left alone. It is your license that is at stake, not the other person. It will shock you what the team will come and tell you. At the end of the day, the nurse is always the one in trouble. So please, let's do the right thing. Forget the team. Forget it. Because there are alternatives for medications. Why is it that the prescriber is not prescribing those alternatives, but would expect you to crash? When you crash, the drugs don't even work. So what's the big deal in crashing something you are not supposed to crash? All right, let's move on. I intend to cover a lot. Okay. So there are some of them that I will not speak on. I believe you can easily read. Okay. Now, one of the things that we don't do very well is identification of our patients. We use bed numbers. It is wrong. Okay. Okay. Thank you very much. Emmanuel is saying there is no emergency situation that you cannot take your time and execute your duty well. Thank you very much. Can you crash? I'm not dipping. Please, I don't know the brand you are talking about. Okay. But you have to look at the brand. If it is crashable, you crash. Right. Okay. So identify your patients. Don't use bed numbers. I have seen it several times. Patients change beds without informing the nurses. If you go and you just please, if the person you people, you are yes, no, you see, when you Gertrude, before I come to what Eunice is talking about, Gertrude, when you take, we have medications that we know we should not crash. One of them that I worked in a pediatric unit for a while, and there were some medications that were available in adult doses. If you take it to the pharmacy unit, the drug preparation unit, they know how to prepare it into a suspension, okay, so that you can administer it. But if you do it yourself at the ward with just your water for injection or whatever, the drug is not going to, you are going to lose most of the drug and it is not going to work. If you need to crash a medication, please, that is why we have the pharmacies. Usually you find it in the bigger hospitals. All right, even where I was saying I was working, if we didn't have that service, so we asked the parents to take the medication to Confanochi, where they have a unit like that. They prepare it and we ask them to bring it back to us. We liaise with the team there and we educate the patient on how to administer it, how to keep it and everything. Okay, so if it's done that way, it is going to work. But if it does not, then please, it has to you can't just be crashing medications and opening capsules. The other issue that Eunice is bringing up, please, Madam Eunice, if a patient cannot swallow, and there is an NG tube, look for an alternate drug. If the person is on nifedipine, look for an alternate drug. Other than that, you talk to the pharmacy units, let them tell you, okay? Let them tell you how, or you take it to them, they will prepare it in a way that it will still be effective. That's what I will say, okay? All right, let's continue. Please identify your patients very well. Like I was saying, use at least two identifiers. The patient's full name and maybe the age or the hospital number will work. Don't use bed number, please. No bed number. You go and the patient is on another bed. I've seen patients do it many times. Errors can happen. When they happen, please yeah, so what BP medication are you talking? The nifedipine. I don't think it was nifedipine, because nifedipine is supposed to be dissolved in the small intestine, and that's why it is coated, unless there are brands that is not coated. Okay, I don't know, there may be brands that are not coated. So if there are brands that are not coated, then yes, it may work, but I don't know the brand you are talking about, and so I cannot speak to it. But if it is coated and you chew it, you lose most of the drug. Please, when errors occur, report as soon as possible and document properly. Okay, question any questionable orders. You can't see the handwriting, you don't know whether it's 50 or 100 or whatever. Please verify. Okay, I want us to quickly move to the right. Quickly, today I have a lot of things to do. So we know the first 5. A lot of us even know all the 10, and we are supposed to ensure all these rights. I want to talk about the right to refuse. Please, the right to refuse is not just for the patient. Okay, as a nurse, you also have the right to refuse to administer a medication. Now, you should refuse it based on your clinical judgments, not how you feel or how angry you are with the doctor or the patient. If it is not in the best interest of your patient, you refuse. Please, don't go and administer any medication that you know very well, very well, that it is going to cause a problem for your patient. Okay, and then the right education and information, also very important. Please again, educate the patient about the medication, why they are taking it, how much they are supposed to take it, when they are supposed to take it, for how long they are supposed to take it, how to store it, and whether they need to come for a follow-up or not. Enye anapa fa baako, ewia fa baako, enyumre fa baako asem. Please. You see, we are going through all of this so that we will change the way we practice. Please, if it is a child, please, I was coming to, I just remembered, if you refuse or the patient refuses, there are things you have to do. First of all, if a patient refuses, okay, you need to document. Convince or coerce. Educate the patient. Provide the necessary information to see if the patient will change their minds. If the patient does not change their mind, document again that Mr. So and so, Madam so and so has refused, and you report to your in charge and then the prescriber, if that is how the communication chain is in your facility. If it is a child and the parents refuse, the same thing. Talk to the parents, you document, you talk to the parents. If they are still refusing, you document and report it. It is not in your purview to coerce a parent to accept anything or a patient to accept anything. Document. If you happen to have counselors at the unit or another nurse to come and talk to them and everything, and if they are refusing, they are refusing, please. Like Emmanuel did. Emmanuel, I hope you documented this, what you did. If you refuse to administer a medication as a nurse, you need to document why you are refusing and what you did afterwards. Okay? And please, we work as a team. And so no fight. You need to do this tactfully. Provide the necessary information per your understanding. Listen to the other person if it is necessary, and then decide. Once you decide, please document and report to your in charge. If you're the in charge, report to your in charge. I hope that is clear. Okay. All right. Then medication errors. Andy, please, your hand is up. You can unmute.
All right, madam, please, I wanted to know, what if you want to administer a drug, but the patient's relative insists that you should not administer that specific drug?
It's the same thing. Is the patient, the first question I'll ask myself, is the patient mentally stable? Can they take decisions by themselves per our laws? If you are 18 and above, and you are allowed to take decision on your behalf, okay, on your own behalf. So I'll go to the patient and listen to my patient, because the relatives are not my patients at the moment. If the patient agrees, I will administer document. If the patient also refuses, I will document everything, and in addition, ask the family to bring a letter. Okay. If it is a minor, please, you talk to the parents. If they refuse, please document. Let the patients bring a letter that they are refusing, so that at the end of the day, if something should happen, you will not be blamed because you did not. If the patient is unconscious, then the family stands in. But in all of it, documentation is important. And then also ask the relatives, if they are still insisting, ask them to bring a letter. Okay, Finoria, please, you can unmute.
Thank you, ma'am. Please, about this right to refuse. So, with the team again, in a case where a doctor prescribed diclofenac for a patient a known PUD patient, and the patient insists that he knows he's having PUD, so he doesn't want to take the drug. Then you explain to him, and the doctor also explains to him, and the doctor insisted and gave the drug. What would you, the nurse, do? Would you report as such? Would you document as such that is the doctor that insisted it?
Yes, use your clinical judgment. No, me, I would not administer, because our professions are different. Our job descriptions are different. In that instance, I know based on my knowledge in pharmacology that diclofenac, which is an NSAID, is contraindicated in patients with PUD. Okay? If the doctor is insisting that I should give it, based on my knowledge and clinical judgment, it is not even based on what the patient is saying, I would refuse. I would document and report to my in charge. If the doctor insists, the doctor can come and administer the medication by themselves. It will not be me. If the patient will take it, that is fine, but I will not do it. Benjamin, please unmute.
Hello, Doc. Please, good afternoon. Please,
Yes,
this
please.
question is
Go ahead,
still
please.
about the right to refuse, but it's a little way of medications. So, say there is a child, you are the case warden, and there is this child with a very low HB, and then you have to administer blood, but per their religious belief, the child shouldn't take blood. You, as a nurse, as an advocate of your patient, and then the parents have their own belief. So what should you do? Should you stand in for the child, or you go with what the parents are saying, that they don't take blood, so you
My
shouldn't take
dear,
blood?
the same thing I will say. Document. That is the first thing. Once you document, talk to your superior. Let them talk to the patients. If they are still insisting that the child should not take it, you are not, even though we advocate for our patients, you are not a lawyer. If the facility has a lawyer, call the lawyer to come in. If they don't have a lawyer, let the parents go and write and bring it. Usually when you bring the writing inside, they change their minds. Okay? Don't do the job that you are not supposed to do. What you have to do is to talk to the parents to see if they would change their minds. If they are not changing their minds, talk to your in charge. If the in charge comes in, talks, they are not listening. I've seen facilities where they've discharged patients based on this. That what we want to do, you don't want us to do. If that is the case, then we cannot take care of you. Go to your wherever they would listen to you. That is one. I've seen a situation where once the parents refused, the lawyer came in and stood in as the lawyer for the child, and we gave the blood. The parents couldn't do anything about it because there was a lawyer involved. Okay, this lawyer was a medical doctor. And so please, if you have a lawyer available, leave the rest to the lawyer. If not, please, you can get them to write a letter, and then you put it on the patient's folder. You care for the patient as best as you can, praying that nothing will happen. If something happens, then it is not your fault, or you discharge your patients. Okay, I hope it's clear. But you see, all of these things, please, documentation is important. And because of time, I don't want to share a lot of experiences. Hopefully, if we can get some extra time somewhere, it will help us. So there are several errors, medication errors, anything that causes the patient to receive a wrong dose, a wrong drug, a wrong form of the drug, whatever it is, becomes an error. It can happen to the right patient, and it can happen to the wrong patient, meaning that the right patient receives a wrong drug or a wrong dose, or the wrong patient receives the right drug. Okay, all right. Now, when an error occurs, please, you see, somebody wrote something, and I just want to reiterate that. Loretta, so Jemima shared an experience, all right, and then Emmanuel and Loretta and Gertrude, they all commented. And I want us to understand something. You see, when that lady lost her child at that hospital in Accra, at the end of the day, I hope all of us, we paid attention to that story. Who was being blamed? They were not blaming the security men. They were not even asking whether the hospital has security. Which people were being blamed? Nurses. And usually in Ghana, when they say nurses, it's nurses, midwives, public health nurse, whatever. At the end of the day, they were saying because you were not wearing name tags. Instead of questioning our security system, we are blaming the nurse who was probably doing their job. The nurse was doing what they were supposed to do. But we were the ones being blamed. And so for me, based on some experiences I've had earlier on in my practice, there's nothing there's nothing that I would put my pin against. Not me. My pin. The way I've suffered before getting my pin. No, I'll do my own. Make sure I do my own and do it well. Okay? I'll make sure I do it and do it well. I will not go and do somebody's job for them. Alright, let me quickly move on. I believe that all of these you can read. Okay? That's why I'm skipping. They are not so difficult to understand. And so I believe you can understand the orders and all of that. I just want to move on to this. I wanted to spend just about an hour talking about that. And if we have if a patient absconds, they blame the nurse, not the fact that there is no security. You let me move on to this part, dosage calculations and the abbreviations and all of that. Okay, and please, here we all know medication orders. Okay, medication orders. Please, like I was saying, Finoria, I don't know, maybe you were not paying attention. I answered this question earlier on. Okay, I don't know the brand of nifedipine that they were given. There are some brands that depending on how they have they made it, the constituents of it, you can crash it. There are some that they've written on the box, do not crash. So I don't know the brand. If I know the brand, then yes. All right, let's move on. So there is I want to talk about this one, QID, QDS, and then the Q with a 4 inside or a number inside. There are two different things. When you see QID or QDS, it means that give the drug 4 times within the day. That's what it means. So within the waking hours of the patient, give it. So you need to determine the waking hours of your patients, and then you divide it into 4. Usually we say, oh, every 6 hours give it, so that you get the 4 times in a day. But Q with a number in it means that you need to go strictly by the number that is there. So if you see Q8H, it means that every 8 hours on the dot, give the medication. If it is Q6H, it means that every 6 hours on the dot, meaning that if the medicine started, you started giving it at 6 p.m., the next dose should be at 12 a.m., 6 a.m., and then 12 noon. Okay, on the dot. Here it is not plus or minus. You have to give it on the dot per that hour. But if it is QID or QDS, please, you are giving the drug within the waking hours of the patient. Okay, and then another one, start. Start means give immediately. Not that wait till the patient gets the medication. It means that you go and find the medication and come and give. That's why we have emergency stock, or we stock some medications in the ward. So when you see start, it means give it immediately. The moment is, some of us start, we wait 2 days, 3 days, we have not given it, and the patient is there. Start means start, please. All right, and then these days we are saying that do not write. Finoria, your hand is up. Please, you can unmute.
Yes, doctor. Please, my concern is about the start. So this prescriber prescribed a medication, for instance, tramadol, IV tramadol, and then she instructed that you put it in normal saline. Then on the normal saline prescription, he says start, and for the tramadol, he says start. And then when he said we should infuse the tramadol into normal saline, and we set it up. So when she came back, she said, when I mean start, I said set everything at once, like it should go fast, like one. Then we understood that you put the tramadol inside the normal saline and set it up slowly to go slowly.
So you need to calculate the flow rate. Did you do that?
The flow rate.
Did you calculate the flow rate?
Yes, please.
Did you?
She gave a flow rate. So when it got me confused with this explanation. Yes, I know it's supposed to be given immediately, but in a case when it's supposed to be infused into a fluid, and the statement again he mentioned to confuse me the more is that it's supposed to go immediately. Like if it is like, say for instance I would have said okay, start means I give the injection and it's gone.
My dear,
so please kindly help me get this start.
Don't know what they are doing. No, listen. Start means give immediately, but it does not mean push it all at once. If the form is such that you can give it let's say it's an oral medication, so the patient swallows it, it's gone. It's an IM, it's given, it's gone. But we all know that when you are supposed to add tramadol or any medication into a fluid, it is administered over time. All you need to do is calculate the drip rate and set it up, and you set it up immediately. You didn't wait 2 hours, 3 hours before you set it up. So you need to explain to your prescriber that please, you said it's a start, and it's a start because you gave the order, let's say at 7 a.m. The medication was set up at 7:02 because we had it, we've started. But the amount of fluid now is maybe 502 mils, and it has to run over a period. We can't push all of it immediately. I don't see where the confusion is, honestly. Okay. Don't sometimes, okay, sometimes our prescribers, they need some small education. It is not that you are being too known, okay? It's not that you are being too known. If they want you to administer it in normal saline and they expect you to infuse all of the 500 in under 2 minutes, they should write. If they don't write, my dear, do what you know, because 500 milliliters of normal saline, you can't do it, you can't administer it in under a minute. Okay, So please, forget them. Okay, all right. So this is what I was saying. I've already explained this. Let me move on. These ones we recommend that you write them the way it's supposed to be, in full, not the way we used to write it. Okay, at bedtime or at night. If you can, add a specific time at 10 p.m. with consultation with your patient. Okay, if they sleep at 10, please, you see, it's because of what one of us said. We don't document and we don't speak with facts. If you don't speak with facts and if you don't document, you are not the person who likes documenting. Oh, they will treat you anyhow. But me, everything I'll write. I will make sure I write everything before I leave the ward. If I'll write. When they know you like writing, they will look at you carefully. All right, let's move on. So these are a few abbreviations and how it is written. I think the documentation part, I will leave it, and I want to move on to drug administration. Okay, sorry, dosage calculations. So I'll stop here and then share that one, and then we will start. We will not finish today, but don't worry, God willing. Please, before I move on, next week is a holiday. It's another holiday. If they don't, please, Sister Mabel, it shouldn't be your worry if they won't accept what you are saying. Okay, it shouldn't be your worry. Leave them. Just do your documentation. Okay, just do your documentation. Whether they accept or not, that shouldn't be your worry. Just leave them and do your documentation. That is very, very important. Okay, do your documentation. That is more important than how do I call it, whether they accept it or not. Do your documentation. I know what it has done for me, and nurses I've worked with, those who have worked under me, and how it has shaped our practice. So when I say just do it that way, I mean just go ahead and do it that way. All right. And your colleagues are Phenoria. Okay, so you are saying that IM diclofenac does not have effect on PUD since it does not get absorbed in the stomach or the intestine. Okay, Sister Phenoria, if you look at the mechanism of action of the NSAIDs, they work by reducing the production of prostaglandins, and prostaglandins is what protects the stomach lining. And so if you administer the NSAIDs, you are going to reduce the amount of prostaglandins that are going to be produced. All right, and so it still does have some effect. It still does effect on PUD. That's what I would say. And for me, personal experiences have taught me that NSAIDs, if you have PUD, if you have any renal disease, please avoid NSAIDs. To be on the safer side, avoid them. Okay, all right, so let's calculate some doses. All right, let's calculate some doses. Please, I hope you can see my slide. Can we see the slide, the page I am showing is this. Does a drug have a grace period? Well, that is what some of the pharmacies say, but sometimes too, I've met pharmacists who says that if a drug expired, it has expired, don't use it. Okay, all right. So let's go on. So to be able to calculate doses, you need to have a fair idea of the various units that we use. So we in Ghana, we use the metric system. Sometimes we've used the apothecaries before. We also use the household. So the apothecaries have the grains and the pounds and the ounces. The household, we have the teaspoon, the tablespoon, and the rest. Okay. And then the metric system, we have the kilograms, the grams, we have the milligrams, the milliliters, the liters, and the rest. So that is the measuring systems that we have. You should be able to convert between the measuring systems. You should be able to convert between the measuring system. At this level, that is not what we are supposed to be doing. You should know the equivalent of 1 kilogram in grams already. And so we would skip this part, but I have made it very easy to be able to understand. So this is kind of a reminder for all of us. Okay, so if you want to convert from the kilogram to grams, multiply the kilograms by 1000. If you want to convert from grams to kilograms, divide the grams by 1000. So this is quite a simple way, and you don't need to do extensive calculation. Okay, if you have kilograms, just multiply it by 1000 and you get your grams. For instance, if you have 2 kilograms, you want to convert it to grams, just multiply it by 1000, you have 2000 grams. Okay, so that is what this part is all about. Now I want you to go through this very well. We are going through it, but please, it's a major part of the end of semester exam. I am saying this so that nobody will come and tell me when you go to the exam room you see calculations there, but madam, you said only objectives. Please, it's also objective. If you look at the questions, it is also objective. It is not essay that we are going to be doing there. All right, and then before I move on, there are some incorrect ways we have been using some of the abbreviations, okay, or the symbols and the abbreviations for the various units. So a lot of us, I will go to this one. In fact, these two, and you can see it. A lot of us in the hospitals, we write this way. This one, true or false? Please help me. In the hospitals, how do we write milliliters? So milliliters, usually, this is how we write it. A lot of us, almost everybody, but it is very wrong. Milliliters, if you write this, it means Mami Lydia store, Major League Soccer, what else? Linda. So please, it is wrong. Let's stop. The correct way to write milliliter or milliliters is this one. Okay, this is the correct way. Either M capital L or M small l. The same way. Liter, we don't write letters this way. Some of us, this is how we write it. It is wrong. Hour. So please, in the exam, if you write MLS for me, it is wrong. If you write a number without a unit, it is wrong. If you write a number and unit together, it is wrong. I keep on saying it, and trust me, in the next few minutes, a lot of us will be doing the same thing. Let's be here. We will be seeing all of such people. So let's use the correct way, okay, of writing the units. Please. Milligram. Some of us, we write and put a dot there. It means different things. So if you go through it, I have explained how to use it. Please, yes, please, let's be careful with these things. Okay, all right, now let's do the calculation itself. So I would talk about this and then we'll move on to do the. So if you write a number with the units, so let me show you something. Where's mine? Is it this one? Okay, please, I'm showing you a blank page right now. Please, can you see? It has the word hello written on it. Can you see? Okay. Oh, please, can you see it? Today I'm using tools. Okay, I think you can see it now. So let me clear this one off. And then write. So when you are writing a number in a unit, please, this is how we write it. So I want to write 20 milliliters. If I write it this way, 20 milliliters, it is wrong. Please, I'm using a pen. The L is not coming very well. Let me erase. Okay. All right. Please, have you seen it? This is wrong. This is wrong. This is right. There should be a space between the number and the units. And we don't write MLS. Please. If you write it this way, you are wrong. And you can't write a number without a unit. If I come to your ward and I write, give the patient 20, am I talking about 20 cups, 20 milliliters, 20 liters? Or if I come to the ward and I want to give you money, and I say come for 20, and you know I have just returned from the US, won't you ask me, are you saying dollars or cedis? Because $20, right, and 20 Ghana cedis are not the same. Are they the same? They are not the same. They are not the same. Okay, so please, let's learn to do the right things. All right, we will come back to the board. So in calculating doses, there are a few ways you can do that. We have the ratio and the proportion method, and then there's also the formula. All right, so for ratios, you are comparing two things, and you can write ratios as fractions. And then proportions, when you compare two ratios, then we are saying that you are doing proportions. So back to my board. Please, let's be very careful. Today we will see those who have learned and those who are not learning. We'll see it very soon. So let's talk about the ratios and the proportions. Let me go back to my board. If, for instance, I write, so we have paracetamol suspension. Usually it says 5 milliliters in 120. I should rather write it the other way around. So we have 120 milligram in 5 milli. Oh, wow, is the pen writing this way? Please, just a moment. I don't know why. I have to hold just a moment. So 120, okay, milligrams. If I have a prescription like this, is the same as 120 milligram is to 5 milliliters, and it's the same as 120 milligram over 5 milliliters. Okay, it's speaking to the same thing. It's speaking to the same thing. We are comparing two units, to the weight and then the volume. All right, we are comparing these two. If I come again and I write 200 milligram in 10 milliliters, is the same thing here. If I write it this way, now if I put these two together, 120 milligram over 5 milliliters is the same as 200 over 10 milliliters. I am comparing two ratios. Please, is that clear? Please forget the paracetamol. Okay, what I want to do, if I use paracetamol, it won't help. So let's just use these numbers. Okay, so if this is a ratio, this is also a ratio. If I compare ratio 1, so let me make this 1 and 2. If I compare ratio 1 to ratio 2, I'm comparing, I've set up a proportion. Okay, and if I want to know any of it, I can easily get what number I want. For instance, if I say I have a medication and it is available as 150 milligram in 10 milliliters, and I want a volume out of this that will give me, say, 35 milligrams. I don't know its equivalent in volume, and so I will set it up as what? A ratio. So this is 1, this is ratio 1, this is ratio 2. Now I am looking for S. if I put the two together, okay, now I'm supposed to be pressing on a particular button. Okay. So if I set this up and say if 150 milligram gave me what, 10 milliliters, and then I am looking for 35 milligram, that will give me X milliliters. I have set up an equation. Thank you very much, Madam Regina. I don't like using those mathematics words because some of us, when we see anything mathematics, we want to run away. Okay, so don't bring in the simultaneous equations and algebra and cosine and all of those things. Please, here we are doing simple mathematics. If more, less divide. We don't want to scare anybody away. All right, very good. So I'm looking for X. X is missing, and I have to make X the subject of the equation. Okay, I want to make S the subject of the equation. Now you can do it in several ways. Some of us are very sharp, and so we can just go ahead and find X by doing the division even in our head. Some of us, we need to write to be able to do it, and so for some of us, you have to do cross multiplication. So some of us will put the cross multiplication sign there. Okay, some of us will ask ourselves, if 150 gave us 10 milliliters, how much would 35 give us? It is going to give us something less. So if less, more divides. Whichever way that you go about it, we just want you to make S the subject. Okay, so let S stand on its own. Thank you very much, Sister Regina, for asking Sister Kisiwa where her milliliters is. It is missing. She can't find it. Alright, so we are making X the subject, and we have asked ourselves, if more, less divide. If less, more will divide. And so 35 milliliters is going to give us less in terms of the volume. We are not going to get the 10 milliliters. It's going to be less. So if it is less, more will divide. So 35 milligram over 150 milligram times 10 milliliters. And I believe that some of us, we have done the calculations. This zero can cancel this zero. Now you will need a simple calculator. Please, in the exam, you will need a simple calculator. I am saying it, please, simple Makola calculator. You don't need a scientific calculator. You need a calculator that can add, multiply, divide, subtract, find the square root or square a number. That's all you need. And you can find this on a simple Makola calculator, not a scientific calculator. So everybody, when you are coming for the exam, please come along with your own calculators. We are not using the phone calculator. If you go and bring a scientific calculator, learn how to use it. Last semester in the exam, somebody went to get scientific calculator and she couldn't use the scientific calculator. So please, no scientific calculator, Makola calculator. What is the answer? So 5 will go into this 3, 5 will go into this what? 7. So that will give us, this will go into it 2 times. So 2.33333 something. Leave your answer in one decimal place and you have 2.3. Please, I believe we are all following. And we can see what we have done and arrived at this answer. Alright, we move. So I want to give you, hello? Please, I hope we are all following. Please, yes, thank you very much. Emmanuel, how are you going to pour that liquid? Yes, please, 1 decimal, please. 1 decimal, please. Gifty. Yeah. They are telling you something. Look at it. Okay? Gifty. Look at it. Yes, of course, another example. Alright. Your patient has been ordered, listen to it. Your patient has been ordered to take 457 milligram of amoxiclav. 457 milligram of suspension amoxiclav. Available, you have 625 milligram in 5 mils. 625 milligram in 5 mils. Please, you are supposed to be paying attention. Pay attention. Be paying attention and listen. The patient has been ordered. Let me share. Which screen am I sharing now? I'm still sharing the blank one. Good. So the patient's order is 457 milligrams. Available, you have 625 milligram in 5 milliliters. How much would you pour for your patient? What volume would you give to your patient? Let me see if is this thing. Okay, let's see the answers. So Mr. Luke, I'll give you half. Emmanuel, Gideon, and the rest. Jemima, you get half. As for Sister B, I'll mark you wrong because there's no unit that is capital L and capital M, capital L. So you get it wrong. Same goes for Prince Otin. You get half. Okay? You get half. And that is, you see, some of us, we do this, and then when we are, you write exams, then you come out, I wrote, but we have a marking scheme, and if it is not what you have written, it is wrong. As for Sister Abena, I don't know what unit you have written, so this one, if I see it in the exam, it is wrong. Okay, let's see how we go about it. So we don't know the equivalence of 457 in milliliters, so we can look for X. Just space purposes, if 625 milligram is equal to 5 milliliters, that means that if I pour 5 milliliters, I have 625 of the active medication in it. Alright, I am looking for equivalent for 457 milligrams. Okay, so proportions, ratio and proportions. You can do cross multiplication. Here is X. You can equally do if more, less, divide, if less, more, divide, and all of that to get your answer. So if 625 gave us 5 milliliters, 457 will give us what? It is definitely going to be less. So that should guide you, telling you that at the end of the day, the amount in volume that you are going to get should be less. Okay, should be less than the 5. Okay, all right. So if less, more will divide. So x is equal to 457 milligrams over 625 milligrams times 5 milliliters. Usually the milligrams will cancel each other out. If you do the calculation, let me see, what would you get? Four, 5, 7 divide by 625 times 5. So we are getting 3.656. 3.656. So your final answer should be 3.7 milliliters. In an exam, we usually would I saw somebody write 4 milliliters. That's why I'm bringing this up. Okay, so if you have this in an exam, this would be the final answer, but we also give room for people who round it up to a whole number. But please look at the question. If it is for a pediatric, please leave it in that decimal place, because you don't want to give more than what the child would need. Okay, if it is a pediatric, leave it. If it is an adult, the question is for an adult, yes. Please, the L, it can be small l, it can be capital L. The explanation is in the notes. Usually when you are writing the small l, and even on the computer, it looks like what do you call it, 1. So they advise that use the capital L, but small l is also acceptable. Okay, now if you go through the notes that I have shared, you see some instructions that are given you, but because of time, let's quickly move on. Okay, let's move on. I believe we get this one, and so let's move on to the formula. It's similar. In fact, the formula is similar to it, and this is the formula that is used in calculating doses. Okay, look at the formula here. The formula is the desired dose divided by the quantity of solution or the drug. The desired dose divided by the strength on hand, multiplied by the quantity of solution or the drug, and then that will give you your unknown quantity of drug. So this formula, you can use it to calculate for both quantity and volume. Okay, you can use it to calculate volume, you can use it to calculate quantity. All you need is the desired dose, that is what has been prescribed by your patient, for your patient, the strength on hand, what you have available, the quantity on hand, or the quantity of the solution or the drug. Usually for solids, so for tablets, capsules, pills, and those things, it is the quantity is always 1, unless otherwise stated. It is 1 tablet, 1 capsule, but the volume changes. okay, the volume changes. So let's look at an example here. Okay, now for the volume, you can also use this formula. If you are just looking at volume, you can also use the same thing. The strength required time divided by the stock strength times the volume of stock is the same thing. Okay, so an example is here. A physician orders 500 milligram of ibuprofen for a patient, and you have 250 milligram tablets on hand. How many tablets would you give? And some of the questions on the word, you see, it is most of the time you should know what some of these things. You shouldn't be waiting for a formula. Usually it's the volumes that we use the formula to calculate. But for quantity of drug, you should know. Okay, because these ones are easy. Please look at the units very well. How many tablets would you administer to the patient? And you are giving me an answer in milligrams. Hey, please, attention to details. So let's look at it and see what we can identify from the question. Desired dose is the 500 milligram because that's what the doctor has ordered. Quantity on hand. So when you went to get the tablets from the pharmacy, okay, when you got the tablets from the pharmacy, that is what they've written on it. If you take one tablet of the ibuprofen, it contains 250 milligrams of ibuprofen. Okay, all right. So the quantity on hand is just one tablet. So we have now identified our variables. We know the D, we know the H, we know the Q. So we can easily come back here and put it in the formula, and we arrive at what? 2 tablets. Okay, we arrive at our 2 tablets. There's another example. So this one, I want you to solve it and give me the answer. The physician orders 500 milligram of liquid ibuprofen for a patient. Quantity of ibuprofen is 500 milligram in 1 cc. Cc is the same as milliliters. Okay. What volume of ibuprofen would you administer to your patient? What volume would you administer to your patient? So if you have an answer, I want to see. Okay, I am administrator. Who is this person who uses administrator? Who is this person? I am going to put you in, because you cannot, your name cannot be administrator. Use your name, please. Use your name. Please, it is not milliliter, so look at the question. Beatrice, check your spelling. And it is not capital, please. I told you people that you enter the room with your name and index number. Name and index number. If you don't rename yourself, I will remove you. I've told you this already. So I don't see why we should still be having this conversation. Up till now, we are fighting over this. I'll put some people in the waiting room. I'm going to do that right now. I don't see, unless you are not a student. If you're a student, you should have an index number. So I'm putting some people in the waiting room right now. Anyway, let me go on. When you change yourself, draw the attention of that All right, so we have that, we understand, and the answer is 3 cc. 3 cc. Because of time, I want to give you another example. Is GCUC administrator? Please, if it is GCUC administrator, you should name himself properly. Let me give you another example, then you try your hands on it with the formula. The prescriber has ordered 160 milligrams of gentamicin to be administered to your patient. On hand, you have 80 milligrams in 1 ml. On hand, you have 80 milligrams in 1 ml. Question 1. What volume would be equivalent to the 160? Question 2. If you are to reconstitute with 8 milliliters of normal saline, what would be the final volume you would administer to your patient? The question again, the doctor has prescribed 160 milligrams of gentamicin to be administered to your patient. On hand, you have 80 milligrams. 80 milligrams in 1 ml. What volume would be administered to your patient? And if you have to reconstitute with 10 milliliters of normal saline, what volume would be administered to your patient? So 2 questions in one. Two questions in one. So I expect 2 answers like Salifu has given us. Some people are getting, okay, it's number 1 and number 2. Okay. The way you've written it looks like 1.2. So there should be a space after the number 1 and then the number 2, so that it doesn't look like 1.2. Okay, yes, you need for the so you can name yourself Hello. Hey, and you are in my class. I'll remove you. All right, so you have to give 2 milliliters because 160 milligrams in terms of volume is 2 milliliters. And I'm saying that you are reconstituting with, please listen to me. You are supposed to reconstitute the volume that you get with 8 milliliters. 8 milliliters, please. And so you are supposed to get 10 milliliters. Charles, question 1, your answer is correct. Question 2, you get half. Sarah, Wendy, I don't know where you are getting your 16 milliliters from, but the question 1, you are right. Ajwa, I don't know where you are getting 12 milliliters from. Sarah, I don't know where you are getting your 20 milliliters. The question is, if you are to reconstitute the volume with 8 milliliters, what would be your total volume? So 10 mils, because you have already 2 and you are adding 8, so that gives you 10. Okay, that gives you 10. All right, very good. We will end here. Next week we'll continue this discussion with pediatric calculations, and then also the flow rate and a few others. Okay, all right. Please, question. I have something that I want us to discuss. Next week is a holiday, but we still have a lot of things to discuss. Friday is a holiday. Saturday is not a holiday. Friday is a holiday, and we have just about 2 or 3 meetings. If we take the holiday out, we will have just about 2 meetings before exam starts from the 13th of April. So I want to ask if it is possible, okay, to do things. I want to also do a short quiz today, and so I am going to share the link. This one, based on where I find myself and everything, I'll share the link on your page. Okay, I'll share the link on your page. So take your time and do it. It is going to be timed. Okay, it is going to be timed, and so please, even though some people are, it's not about this one. Next week, please, we will have a quiz. It will be in class. So that this one is not about the calculations. This one is about what we've done on pharmacodynamics and a little bit on drug administration. Okay, so I want you to take your time. You are supposed to start after the class, so I'll give you room. Your next class, you have about 15 minutes break, so you can use that time. It is not active now, so if you leave and go and do it, it is not active. It will become active after the class. It will become active after the class. Okay, but I'll share the link. 2, I want to crave your indulgence and see if we can meet. If we can meet, I don't know, Friday. I don't want to be insensitive because Friday is 8, and so I don't want us to meet on Friday because some people will be celebrating. Is it possible to meet on Thursday 3 to 5, please? Is it possible? Please. Hello. Can we meet on Friday, because we are a little bit behind for pharmacology? Yes, I am getting good. So a lot of us, okay, a lot of us think about those saying let's meet. Please, we are not meeting on Friday. Okay, it is not Friday. Friday is 8. And me, I'll be waiting for people. Okay, I'll be waiting for people to bring me the meat. So me too, I'll be celebrating. But I'm just craving your indulgence. I can equally do a video and send it to you. But the thing is that a lot of us, when we send the video, you don't watch. When we give notes, you don't read. It's when you come to class that you get something. That's why I am saying if we can do it. You give us feedback through your reps within the week. Okay, no problem. I get you. Last week, Saturday, when I said we cannot meet, I asked the reps, the one I talked to discuss amongst yourself if you can give me some time during the week. I didn't receive anything. I didn't receive any feedback that we can meet. If I don't hear anything by Tuesday, I will assume that you don't want us to meet. And what I'll do is that I'll just record a video, okay, of that part, what we have to do, and then I will send it to you. All right? Okay. That said, tomorrow morning, please, we are meeting. Okay, we are meeting, and we will start at exactly 7 a.m. Please, I am not even to have class. On last week Saturday, unfortunately, one of my sisters passed away, and it is 1 week tomorrow, and we are supposed to go to the family home and do some things early in the morning. I informed one of the reps. It was a sudden death. She was preparing to go for a lecture. She's a master's student. She was preparing to go for a lecture and she collapsed. They took her to the hospital and that was it. By the time they reached the hospital, she was dead. And so I'm not supposed to even have a lecture, but if I don't, you know, the few weeks that we have is not going to help us. So even though I'll be there when it is time, I would excuse myself and go to one of the rooms and have the lecture. Okay, so tomorrow 7 a.m. group 1, group 2, we are doing as many as we can. So please be ready. I will review your submissions and download them. I will be sharing the slides from my end, and if we can, then yes, we will have the lecture tomorrow. We will have it, okay, but we are starting at 7. So group 1, group 2, group 3, group 4, group 5, be ready, okay. Thank you very much. I have shared the link on the Telegram page. And Chelsea, dear sir, don't worry, it's part of it. We will come back. Chelsea is not. It's no news when Chelsea loses. It's when we win that it is news. Augustine, please, your hand is up. Please hurry up because of time. Yes, go ahead.
Hello.
Hello,
Yes.
go ahead, please.
Madam, please, we have a class immediately after your class.
Yes.
We have a class immediately after your class. We don't know
immediately as in what? 5 o'clock?
Exams.
5 o'clock?
No, it's
your
5.
Class
it's
is
5:15. 5:15 rather.
Yes, the exam is.
Okay.
Oh, you don't even need 10 minutes to answer it. Why?
Okay.
Okay, thank you very much. I will see you, God. Oh, we lost. It is no news. Chelsea, it is no news. We lose all the time. So all the best in the exam. Don't worry. We move. So I'll see you guys tomorrow morning, God willing. All right, please. I am opening it now. So go and take the quiz. It's pharmacology. Okay. Thank you very much. I will see you, God willing, tomorrow morning. God bless you. Bye.